Great. Well, often when people go to pathways, the first thing that they're kind of often looking for is where it was originally built was to see who I might refer to and where their wait lists are. And so we used to list all the specialists right on the homepage, but the homepage was getting full. So if you're looking to refer to a specialty, they're kind of all listed here. And as well as community and health authority services. So sometimes people go, oh, I didn't even realize that was down there. I've just kind of gone to, oh, nephrology, or I need plastic surgery, or I need cardiology, or something like that. Just as a quick kind of review, if you were looking for a certain specialty service, it will load up with a listing of, who is accepting patients for in the field of cardiology. I always find really helpful because sometimes you're looking for something fairly kind of specific, because some of the cardiologists do certain kind of areas of work. And if you're kind of thinking, oh, I'm looking for someone who really maybe looks at arrhythmia kinds of things, most of them do, but you will see that it will reshuffle the deck for you in terms of looking who looks at certain kinds of things. If I want like an ablation procedure person, it's already kind of sorted itself out to those kind of people there. When you click on a particular individual, it will kind of give you a fair bit of information about whether they do referrals by telehealth, what kind of things are their specialty. Sometimes I'll find that I'm referring to someone, and in this list I'll see, but does not see or does not do this or that. So it's really kind of helpful going, oh, sometimes I'm starting my referral, but I see they don't actually kind of do that part of things. They will let you know how they're accepting referrals, and often the referral form will be on there along with a little bit of idea about their wait list and things like that. So I also sometimes find it helpful, not on this particular one. Yes, who are the other people in the clinic? So sometimes just by clicking on, I'll see, oh, recently a number of the cardiologists have reshuffled the deck and all moved to Uptown together. And so their new clinic is called the Pulse Clinic, and we can just kind of see who all is there at the same clinic. So that's kind of our navigation through kind of the specialty service kinds of things. Yeah.
Question.
Yeah.
Can you go back to the just where you were with cardiology and they were all listed?
Mm-hmm.
Sorry about this. On the right side, if you scroll down, every now and then one of those things, keep going down. You're going really fast, go more slowly. There's one with what looks like a little linked chain beside it. Oh, where did it go? There's this little
something like this.
No, it's in the list on the right-hand side.
Mm-hmm.
There it is. Cardiac stress test provided on site. What does that often?
Mm-hmm.
Yeah, what does that symbol mean?
I am not sure. That means that that there'll be other links, because cardiac stress testing is sometimes also provided by internal medicine. So it can be linked to other specialties rather than just cardiology. So you'll kind of see like at the urgent medical assessment clinic at Vic General, they also do stress tests prior to surgery. So often it means that this is a service that will also be available in other services. It's kind of looks like a link.
But it's not that I can click on it and open the other people who do it. It's just telling me that there are non-cardiologists who also do that.
Right, because there are a lot of fields where there's crossover kind of specialties, where sometimes like kidney stones. Endocrinology will say, well, I do that, and nephrology says, well, I do that. So there'll be some of those kinds
Okay,
of things.
good. I've just always wondered about that symbol. Okay.
Yeah, they've tried to make it as intuitive as possible. So that's kind of, where Pathways was originally built, was selecting a specialty or a service. And it's we update the our Pathways administrator updates these time lists every 6 months, but I'm going to the very bottom. It should say contact us. So
Oh,
probably once a month. Yeah.
oh,
Oh,
look, that's
here we are in the whole set symbols of everything. Here we are.
that little link. It says it's something else. Wait times provided. Oh,
To this area of practice.
okay.
And so that's where, say if you did a wait time for that with cardiology, you may find that, as I say, internal medicine may have shorter wait times for certain kinds of things. So that's where it says specific to this practice, these cardiology within this, but there'll be other services that can be linked there.
Right.
So it's a long scroll downward, but helpful to review that the icons are all kind of down here. Some of the specialists will be accepting certain referrals. Patients that they've already seen before is the most common thing that I'll see when you've got kind of the yellow kind of click there. I encourage everyone on the contact us, whenever you're doing a referral and you get a referral, it says 2 months and it comes back, oh, our quickest referral is 6 months. To actually do a contact us, that email, it just goes as an email to Cherith, our administrator, who will resurvey that office and go, we hear that our Pathways wait list is not up to date. And so we would like to update, your services with your true kind of wait list. So the contact us can be done for any questions as well. As I say, our administrative person, Jareth, is always happy to hear comments and things like that. I'm just going to spend a little bit more time kind of going back to the home page, because again, where they shrunk all of that down is that, especially during COVID, the homepage became your go-to for breaking news of the day. So anything that's new will be posted here on the front of the web page, on the home page. And it's usually changed every week. During COVID, it changed actually every day, as there were daily kind of updates. But whenever there's something new, it does come up. And Pathways was designed to have links that let you immediately kind of click into things. So there's not necessarily a lot of kind of searching around for things. So the new web form for disability tax credits, it's tax season. So those are all kind of coming into the office. Again, many times people clicking around at the top and don't kind of actually get a little bit deeper into the homepage, but on the homepage will be a listing of all our clinic updates in terms of who is new to town, who might have left town, where someone is kind of listed in terms of you've heard of someone who's doing family practice primary care skin. We are currently having long waits, or many dermatologists were not accepting patients for a while. So we're using primary care dermatology a fair bit to kind of help us out. And so again, just kind of clicking on any of these people will take them to the listing like we saw in cardiology. So the new internal medicine kind of person, their profile is up kind of for what they're doing, and you can kind of see. You were just mentioning the Three Cedars MD. I think Becky was just mentioning them in Sydney. And so it's just kind of showing, oh, there's an endocrinologist here, and they've opened up within a family practice group, actually, and there's one endocrinologist kind of in there. So it's helpful to kind of just see who's coming and going, especially if you're looking for kind of shorter wait lists. More of our established specialists just have much longer wait lists. News updates also go here in terms of programs. So the peer support program, we are having a bit of a crisis in the maternity care field here. And so they have just recently set up an urgent antenatal care clinic. Oftentimes, things will start out in our news flash as to a new program, but often people go, well, I read about it like 3 weeks ago. Where am I going to find it? Most often you're going to find it kind of on Pathways. It'll stay resting here on the homepage and then enter into the clinics, and we'll look a little bit further as to how to find those things in just a second. And then actually most of our continuing medical education in the area will also be posted here. So a recent Dine and Learn that we had, we're actually posting the guidelines here. One of the things that I tend to refer to relatively often is just the outpatient medical imaging wait times. This is unfortunately not able to be live in terms of changing on a day-to-day basis. It is sent to us as a PDF from the Department of Radiology, usually on a monthly basis. So February 3rd to March 2nd. Here, if you were looking for the Royal Jubilee, a semi-urgent CT scan is for 230 days. A routine CT scan is 490 days for a routine CT. Where this has made a little bit of a difference is some of our patients are actually willing to go to Duncan. And getting a CT scan in Duncan will mean that you will maybe have a 350-day or a 1 year less wait to get your routine CT or your urgent CT scan. So part of it is to kind of spread it around a little bit. And I have had a number of patients who go, I live in Langford, going to Duncan for a CT is not a problem for me, rather than waiting another year in Victoria. But that's CT times, MRI times for what's in our area, also ultrasound and all of that. So it actually doesn't change very much. Unfortunately, CT just seems to get longer and longer and longer, unfortunately. But that's kind of, so sometimes I'll even, bring that up to show to patients and just kind of go, here are the wait times. Would you be willing to go to Comox or Duncan to have your CT scan done? Yeah. So then all of our CME events kind of get posted lower down on the webpage. So again, sometimes you may have seen something posted in the news flash for a CME event, and you're kind of wondering, where will I find that? That will continue on the homepage there, kind of going to the bottom. On the right-hand side are clinical tools and resources. And so there is a group of family physicians, 5 family docs from different divisions, who spend time looking at clinician tools and trying to kind of pick the best ones together. Anna Mason from our division used to sit on that group. She said people would be sending in so many things for them to sift through, but it gives you the reliability that other family doctors have actually looked at these resources in terms of what's really helpful or felt to be kind of most important. Some of them are developed locally, and so they'll definitely be posted here, like the pharmacies list, a perinatal substance use pathway kind of done in Victoria, coming from that last kind of Dine and Learn. So anything that's new or going to be newly kind of added on a local level will be here. If there's something new going to be added on a provincial level, that's where this little bell is. So provincially, the team looks at, again, a whole bunch of different kind of resources, and the provincial team will add things for the entire province that are kind of BC wide, not so much Victoria specific. But if you were to kind of click on that, these are kind of the new resources added to Pathways, literally on after their last meeting on March 16th. So you can kind of, sometimes you go, oh, well, wow, there's new clinician tools, new calculators. Sometimes people go, oh, wow, it would be really, with all these new copper IU, with all the new contraceptives being covered, it gives me a little bit of a look at, you know, what are the different copper IUDs that are available. For everybody, there's going to be just something that they go, oh, here is a really helpful kind of thing. And you certainly can favorite it if you come up with something that might be something kind of personally kind of useful to you. So say if we were going to go to this one here, when you open up Pathways, it will take you to that individual resource. And I'm just seeing here, because my pictures of you guys is just on the side here.
You could put it to the bottom.
Yeah, I just moved everybody to the bottom there. I'm just seeing, normally we can favorite them, but
Go back a page, there was a heart.
Right there we are.
Yeah.
So that's to favorite it in your personal kind of set of favorites, because there are thousands of resources on Pathways right now. Now, the group also takes out a bunch of them. So they kind of go, you know, we don't actually need 12 knee ones. We need a variety of ones for different people who have maybe different educational backgrounds or patient preferences or groups like that. So they don't kind of go, oh, there's only going to be one particular kind of thing available. But they also say it's not helpful to have like 12 or 20 of them. So those are the lists of all the new kind of resources that are available. If you're looking at, well, where would I be looking for resources? There are clinician tools, and those are kind of things like calculators and guidelines, things like that. There is the patient information. That's where most of my favorites are, to be able to email patients information. Just a reminder, when you are emailing information from Pathways, it comes from the Pathways website, which is a no reply email. So we'll go through maybe doing one of those just to kind of remind people of kind of how that might work. As I say, we've got a diverse kind of group of people here, but I'm just going to, this is my list of favorites in my list. And so a lot of ones that I tend to kind of send out are say like a migraine headache related one. Which kind of looks like that. And what we can do is, if we're going to decide that we're going to email this to the patient, you can email a whole bunch of things when you're within kind of your favorites or when you're within a category. Sometimes people have said to me, I want to email different things about different areas. You may not see this email selected items if you've got references from neurology and references from gastroenterology. normally this email all the selected items. I can click a couple of them for migraine, and I just kind of go, oh, I'm going to do those two. So when I am emailing that to the patient, so if I just email that to me, I can include a message. Here's the information that we spoke about, emailing it to the recipient. When I have sent that off, I can copy this whole note in yellow into my clinical note in the EMR by simply clicking copy to clipboard. Then when I open my EMR and click in the patient's file, it will document for me everything that I've emailed, when I emailed it, and that I had kind of patient permission to kind of do that.
Kathy, is that true for all the EMRs?
Yes. So this is simply a copy and a paste, and it'll just, as you open your EMR, when you Command V or do your paste, it'll just copy it into there.
Okay.
Yeah.
Yeah. Okay.
Kathy, this is maybe, and you don't need to do this, but I find I haven't gone through all of the resources available. And then when I'm going through an issue with a patient, like migraines, for example, I'm like, search migraines, patient handouts, and there's like 95 things. And then I'm like, oh my God, I'm trying to like go into them, see which ones I like and stuff. Would you be willing to send around afterwards a couple of your favorites, or even like the title is like, because I love Mike Evans. I didn't even realize he had video links on there, which is great.
Yes.
Just to even like fill up our banks so that we could have something to then like easily access as like kind of, you know.
Well, maybe Kathy, why don't you show us, instead of looking in your favorites, let's say we came on and we didn't have a list of favorites and we wanted resources on, since we're saying migraines.
So there's a couple of ways of going there.
Where and how would you do that search?
So there are two ways that I generally will do that. Sometimes I will go into neurology, and because neurology, I'm going to go across the top to patient info, which will have narrowed my search already to all neurologically related patient information. So I go, okay, well, there's ALS, it's all alphabetical. So these are going to be all the neurology things. And again, I can email multiple items. Sometimes you've, as I say, had a good look at them. Other times you may take a small leap of faith and go, other family doctors in the provinces have looked at these and made sure. We always make sure that they're not pharmaceutically based and that they're evidence-based. And so you will see sometimes some protocols or things that are made up by specific doctors. We have a couple of pediatricians who have sent a number of things that they've just created handouts for their patients and said, I'm willing to share those on Pathways provincially. So not every pediatrician needs to reinvent the wheel on doing a patient handout. But if you were kind of going down, and now we're looking for migraine. So here we come to migraine, and in the big picture, there's 1, 2, 3, 4, 5, 6, 7. Again,
Okay,
children. Yeah, so that's not an overwhelming list in terms of the number that are there. Another option is to go into the search and put in migraine.
This is on the home page.
This is on the home page. If you put in migraine, everything that has the word migraine. So here it'll be migraine, the specialists that look after it are internal medicine, neurology, pain management.
That's
a list for you who does Botox for chronic migraine in that list. There'll be community services available for migraine, and then clinician tools in terms of a pathway or algorithm for migraine. There'll be patient information websites, diagnostic tools, patient information handouts, and that's where
that's those 9 again.
Yeah. And then choosing wisely in terms of migraine. So if you do a migraine search, it'll come up everything possibly related to migraine. If you go through the specialty, you get kind of a look at maybe all of the neurology things, because I'm really specifically then can go into patient information or clinical tools, kind of listed all across the top here. If you wanted to see community and health authority services, let's see what we've got coming up here. No community or health authority services for that one for us. For mental health, you'll come up with a huge list of community and mental health kind of services there. So if you are looking for a type of calculator at any time, move that out of the way. So I know sometimes I am, the liver specialist will say to us, can you give us a FIB-4 score for this patient so we can help to kind of triage things? So most of these scoring systems are kind of all available under the resources as well. And the other one is forms. So Pathways is the provincial forms repository for every form in the province. There are 2,000 forms on Pathways. We do try and keep it as up to date as possible for the up-to-date made forms and everything like that. So Cherith, whenever a new form comes out, she's checking it with our local kind of references and updating the forms. So I have many times have, say, done a palliative care, say consultation, and they'll say, well, the end of life forms with regards to anything that we do for palliative care orders or things like that, all of those forms are on Pathways. You will often see patients or specialists say our forms are on Pathways. And so sometimes you're looking for a notification of an expected death at home or palliative care benefits form application. Every form is listed in Pathways under these disability certificates, insurance certificates, every form in the province is here. Sometimes so the U tab was always interesting to me. What about me? Probably the most helpful thing here is the training videos. So kind of what I'm going through here, sometimes you go, I can't actually remember what she said in that meeting. I know it's going to be recorded, but the training videos about our care, it's an unfortunate wording, care pathways. So the word pathways is overused a little bit. Unfortunately, the whole program is called Pathways, and within Pathways, there are care pathways, which individual specialties have developed to try and assist you working up or working through a process before you actually do a referral, so that you sometimes maybe don't need to do a referral, or you feel like you have much more resources kind of along the way. So if I'm just going to go back to our homepage, our recently developed care pathway is just kind of featured on our homepage. Advanced heart failure. It's not really being called a care pathway, but it is like that. So this is a shared care partnership between cardiology and palliative care on the island. And what they've done is developed a care pathway, which helps you work through the steps of a patient with heart failure, transitioning from early diagnosis to end of life with steps along the way in terms of, in phase 1, we're finding out who are the patient's primary supports. How much do they want to know? Should we start to be talking about, most in CPR kinds of preferences and things? And then it kind of goes through your medical considerations and just questions that sometimes we kind of forget to ask in terms of, are you still driving? Do you need more help? What other things are kind of happening? So you will see certain specialties will have a care pathway. Often they're listed at the top of the service. So if I'm just going here to our specialty of gastroenterology, you will see here across the top care pathways that gastroenterology developed to assist in helping people kind of go through several steps before actually doing a referral, and kind of walking you through, here's what the symptoms are, or any of these things going on. If it's more a dyspepsia, I'm going to move over to the dyspepsia pathway. Anything that's kind of highlighted or underlined means it has a hyperlink to it. So if you go, yeah, that's actually what I need, it's going to link you right to the dyspepsia pathway. Similarly, on the other side, now we're on the dyspepsia pathway, but if I see this underlined, then it means they've already hyperlinked that for me to review the urgency of how do they triage the urgency of the referrals, and how would they like us to word it? Meaning, if one of these things are going on, they consider it urgent. If one of these things are going on, they consider it non-urgent. So those are the care pathways within pathways. Not every specialty has its own care pathways, but interestingly, more and more specialties are developing them. They see the gastroenterology group has had a fair bit of success with helping people kind of work through doing 3 or 4 things before they actually do a referral. Also on that same care pathway, you can directly from it, you kind of go, well, this patient does have GERD. I can directly email them. I don't have to go into my email list. I know we're dealing with GERD here, so I can just directly email from this care pathway the things that I want to email to the patient with regards to that condition. Again, if I want to look it up or see what that reference is, then I can open it up this way, or and look at it myself. Or if I kind of already know what that's kind of like, then I can just kind of directly email that to the patient. The other thing that's quite helpful, I remember, in my earlier years carrying around a lab coat with many books in it, things like bugs and drugs and what antibiotic you would use. Well, bugs and drugs is completely loaded on pathways. So if you put in bugs and drugs, this is the bugs and drugs whole manual listed on pathways. So if you kind of want to go, okay, what's the current bugs and drugs for acute bronchitis exacerbation? It's all listed here. Or if I've got an animal bite, pediatric animal bite, then there's my bugs and drugs for it. I don't need to go to a separate website or carry the manual. I still have the book myself on my desk, but once you kind of get used to using bugs and drugs in here, it's kind of like, I don't need to carry around all these things. Everything is on pathways here. So just kind of the entire, for endocarditis, everything.
I want to throw out that Bugs and Drugs also has a free downloadable app.
Mm-hmm.
if you just kind of wanting to be on your
Right on
phone
your phone.
and
Yeah,
open something
yeah, yeah,
rather than kind of delving in here.
yeah,
That's totally an aside.
yeah, yeah. But nice to know that you kind of have bugs and drugs with available to you in these electronic forms rather than again the books, or I used to carry many, a page of common calculations that you would maybe need to do, and you kind of go, well, all the calculations are on here. So there's a lot on pathways. It's just been a little overview, but if you're kind of thinking, I'd like to learn a little bit more than going to the U and the training videos, just 2-minute, very short kind of videos. I want to do this. How do I do that? I am available to do one-on-ones with people, as is Cherith, our administrator. So sometimes people go, I've had a little bit of a look at things, and now I have some more specific kinds of questions. So those kinds of things are also an option. But it's been about 45 minutes now, and so that's a very quick overview. It's helpful just to know that, oh, I've seen that kind of stuff there. Hopefully, again, because it was built by family doctors for family doctors, I often find when you click around, things are fairly intuitive, even just going into a specialty. So the two things I do is go into a specialty and see all that they've got there. Or if it's very specific what I'm looking for, I'm just typing in the search and getting pediatric constipation, kind of, and things like that. But everything you could need to practice in this province is on Pathways.